Hello, thank you for joining us today. My name is Susan Evans, and I am honored to welcome you to today's webinar. I have a deep connection and respect with Kensington Senior Living, the producers and sponsors of today's event. My father was diagnosed with Alzheimer's disease 10 years ago. Overnight, I went from being a daughter to a caregiver, for my father concerned about the progression of his disease, and my dear mother who had lost her partner in life. In 2015, we made the decision to move my father to a home. It was the hardest thing I have ever done. The guilt was overwhelming. Caring for my father at home was becoming too much for my mother, and I did not want to lose both my parents to Alzheimer's disease. Our family chose Kensington Senior Living because of their expertise and commitment to dedicated memory care. It was the hardest yet best decision we made. The team at Kensington have taken exceptional care of my father over the last 5 years, and my mother, who pre-COVID had lunch with him daily. I am one of the 30 million caregivers in the country, and I applaud the work that doctors, nurses, and caregivers are doing for the community and our loved ones. Our topic today, benefits of moving your loved one into a community during COVID, will answer the very difficult questions and new questions of making that stressful decision that is exacerbated during this epidemic. The stress and isolation caregivers around the world are experiencing is overwhelming. Today, we welcome a panel of experts that will answer those questions. We invite you during the webinar to ask questions as well through the Q&A service available on Zoom. Please join me in welcoming our 4 panelists, Dr. David Giello, Lorrie Marino, Debbie Ray, and Lisa Bricker. May I suggest we begin with Dr. Giello to introduce yourself to all of our attendees?
Hi there. My name is David Giello. I'm a licensed clinical psychologist in the state of California. I started working with the elder community and people in later adulthood at the very beginning of my career. Then had a 10-year sort of gap where I took a job working for the state of California. And a couple of years ago, I decided I wanted to go back and work with elders and seniors. And I joined a company called Wellqor Behavioral Health. It's a national company that partners with assisted living communities to support their residents in a variety of ways, mostly mental health and cognitive development, cognitive enhancement. When I joined Wellqor, I was assigned, very luckily, to the Kensington and Sierra Madre, and I've been the primary clinician there for about 2 years. I'm also the regional manager for Southern California for my company, and so as a psychologist, I am doing testing in a number of different communities, and so I really get a sense of what is out there and what's available, and by, far and wide, the Kensington is, they say, we treat your family like our family, and it really is the truth. Their care staff is more trained than most people in the field. And so I've been working there and working with Kensington hand in hand for 2 years. It's a privilege to get to support adults in this stage of their life. Most of my patients are in their 90s. And to make it into your 90s is extraordinary. And to be able to serve and support and assist people at that stage of their life, it's such an inspiration to me, and it's just a beautiful thing, and I'm fortunate and privileged to be able to do that.
If everyone could be so fortunate to have you in their circle of friends, what a wonderful thing that you are doing for the seniors in our community, and thank you. I just so appreciate it. I actually spoke with David on the phone a few times, and my mother, who is still half widowed, as my dad is still living at Kensington. I said, my mom needs to meet you because you just offered so much. So thank you for what you do. I really appreciate it. Lorrie, can you introduce yourself as well, please?
Hi, my name is Lorrie Marino, and I am the Director of Memory Care at the Kensington Redondo Beach. I've been with the Kensington since they opened up July of 2019. And it has just been an honor and a privilege to work at the Kensington and represent the memory care community. Prior to that, I was at another memory care only community. I received my bachelor's in medical sociology in 2015. I got my master's in social work in 2018, and a part of that program, I had to do 2 years of internships, and one of them was at a memory care community, and that was not my concentration, that was not my major, but I fell in love with the community, I fell in love with the residents, and I was fortunate enough to be offered a position at the community prior to me graduating, and I did spend a year there. I learned a lot. But then the Kensington came along, and I just saw this fantastic opportunity to be a part of their care program and to manage the care. I do assessments with the residents, work with the families, do support groups with the families. I've just finished all my clinical hours, so I will be planning to taking my test to become a licensed clinical social worker in the very near future. But I'm happy to be here. I hope I'm able to answer all of your questions, and thank you so much for having me.
Thank you so much. I really appreciate it. Debbie Ray, can you share a little bit about yourself, please?
Hi. First, I want to say it's a privilege and it's an honor to be asked to be a part of this webinar. My name is Debbie Ray, and I'm here to represent my family, who recently moved our mother from a very poorly run facility to the Kensington. I know the fear and the guilt and the frustration of having to move my mother from my home to a facility and then to a second facility to find a memory care home for my mom that provides good quality care during this terrible time of COVID. So I'm grateful to be a part of this and grateful to have found the Kensington for my mom.
Thank you, Debbie. Debbie and I had a chance to chat because we share so much in common. And as I mentioned before, the guilt is overwhelming, really overwhelming and so stressful on the family. And I moved my dad 5 years ago, and I can't imagine the added stress of moving him during COVID. So thank you for joining us today, Debbie.
Thank you.
And last but not least, Lisa Bricker, who I've had a chance to get to know over the past year or so. So thank you for joining us, Lisa.
Thank you very much. It's my pleasure to be here this afternoon. And I wear several hats with the Kensington. I'm an Alzheimer's and dementia placement specialist. My company is called Gently Guided. We serve the greater Los Angeles area, but we're based in Pasadena, along with my business partner, Frank Cunningham. We love what we do. We're very passionate. I'm an advocate. I've been a family caregiver. I was on a long journey with my husband, who started showing early signs of Alzheimer's when he was 55 years old. So this has been a 15-year journey, and it's been quite a year for everyone. And he passed this year, earlier this year. And I walked that journey with the families that we're going to be discussing today. I have the honor of leading the Alzheimer's and Dementia Family Support Group for the Kensington in Sierra Madre. It's open to anyone. We're Zooming along twice a month, and you're always welcome to join us. We meet on the second and fourth Monday of every month, and then from 6 o'clock till about 7:30. And we discuss everything that may come up. So it is just a pleasure to be here this evening, and we look forward to sharing.
Well, we're very lucky to have you. And to our audience, we will follow up with a copy of the webinar and also include information from David and Lisa regarding their services, so that you can reference and use those as a resource. But I think I'm joining the support group, Lisa. That sounds wonderful. So the format today, we will ask some questions, and it will be the panelists will, or the people here are going to just join in and kind of give us their comments. And really our objective today is to provide our audience with some really valuable information to assist you in making a very difficult decision. And how should COVID impact or alter our plans regarding moving our parent into a community? All I read and hear in the news is that facilities are the worst places for spreading COVID, and I'm really concerned. Should I wait to move my loved one? And David, if we could start with you as a response to that question, that would be wonderful.
Okay. I think that in order to actually answer that question, you need to look at setting COVID aside, really, first, to determine what level of risk is your mom or dad at if you don't put them into a community, right? If you don't move them into assisted living. The reason we move our parents into these places, or we make this kind of a life choice, is because they can't function on their own. They can't manage their meds, so they're not taking them, or they're taking too many. Why else? Or because they're wanderers or paranoid, or they don't, some people, when they are in the earlier stages of dementia, they don't recognize loved ones. And so if you're thinking about moving your parent into a community because they really need the professional services that a community will provide, then the question is, how is the community figured out how to do everything they do in the face of COVID? When COVID first happened, all the stories were devastating coming out of residential communities for elders because we didn't know anything about COVID. We had no idea that asymptomatic people could introduce and contaminate and make other people sick. And so once it arrived into a community, this population was this is the most vulnerable population. But we're 8-9 months beyond that. Everybody in our own lives are figuring out how to go shopping and how to live and how to go to school. And assisted living communities are figuring out how to do what they do. If they do it well, to maintain everybody's safety, so that's residents, staff, to continue to do what they do, which is to provide care, dynamic services, activities, groups, visits, outings in a physically distant but socially engaging way. So it really is a two-pronged response. What is the reason? What are the needs of your parent? And how has the community responded to COVID in terms of access, support, and activity? I guess those are my thoughts.
Well said. Lisa, do you have something to add?
Yeah, I think I love what you said, David, all of that. And everyone's so isolated anyway. And just to add, they are going into a more controlled environment with protocols. It's in a lot of ways, maybe they're even more safe. And we have to look at, from a caregiver standpoint, the quality of life in general. When we are encapsulated in our homes with our loved ones, it's very difficult and it's very stressful. So we're all trying to get to a place where we feel, where we can breathe and be who we are. So I think another thing that I want to make a point of is that there's been so much fear, especially in the beginning, where assisted living, memory care, and skilled nursing all get lumped into the same ball. And it's not quite fair because they're very different environments. And skilled nursing is under the Department of Health Services, very, very different situations. It's a medical environment, where assisted living is under the Department of Social Services, and that is different licensing and different requirements. And I have to say, since we started COVID, this whole pandemic, I am so impressed by not only the Kensington, which offers the best care, but by all the protocols that have been put in place in senior communities are very, very impressive, and they're very safe. And communication is at the top of that list too.
Well, that's reassuring. I'll tell you, such a scary time right now for all of us, and especially, caregivers trying to wear so many different hats. The stress is already there, and with the, pandemic, it just exacerbates it. I'm going to ask the second question now. I don't know how to go about finding the right facility for my loved one. What do you suggest? Lorrie, can you start with that?
I would write down what I'm looking for in a community. I would have questions written down. What's important to me? Is it medicine management? Is it activities? Is it care? Is it what social aspects are included? And then I would want to tour a lot of places. And I think most important, we have Debbie on this panel, is asking for family referrals, because they are you can have a sales team, but when you have a family that supports what you're doing, if you have a family that is happy with the care. Debbie's mom was at another community, came here because she was dissatisfied. And those are the type of people that are going to reassure you that they made the right decision. But it's also that feel, when you walk into the Kensington, you feel that sense of home. You feel that sense of security and trust, whereas at other places you may not feel that. But I think definitely writing down, what are you looking for? What needs do you need to be met? And that's, to me, important.
I couldn't agree more. And one of the reasons that we chose Kensington Senior Living for my father, is we chose it for both my father and my mother, but we also chose it for him because we knew we would never have to move him again. And that was really important to us. Lisa, do you have anything to add?
A lot of people don't know that there are referral services out there for senior living options, and there's no cost to the family. We work with the communities, and up front, we disclose that when someone moves, we get a portion of the first month's rent. It's very clean, and it's all relationship driven. So we help the families with their budget, the personality of their loved one, and what their care needs are. And I consider myself a matchmaker, because I think the energy in an environment is so important to match it with that person and their personality and their likes and dislikes. And of course, the Kensington is at the top of the list. It's the Ritz-Carlton, as I would say, of this industry. And it's about, I always tell my families, how do you feel? Even taking consideration of your loved one, but also you're going to have a relationship with this community. You're going to be part of their family. And, unfortunately, during a pandemic where everything's kind of dampened down, but in normal times, you're coming to all the celebrations and all the parties, and having that communication with the staff. It's so important that everyone feel comfortable. So that's my take. It's about using your intuition as a family member.
I would agree with that 100%. The move-in process. What do we tell our loved one about moving into a community? There is a lot of guilt and fear. Is there a strategy on how to move a loved one in? And Debbie, I think you're probably the best person to talk about that, because your recent experience. Maybe you can share with us what worked for you.
Okay, I would love to share this. When we first realized that my mom was going to need more care than what we could give at home, we felt guilt that was unimaginable, fear because we never wanted my mom to be anywhere but my own home with caregivers helping us. But unfortunately, my mom's dementia progressed, and it came to a point where she said, I don't like my daughters helping me with my personal needs, to I was afraid of my daughters. Now we realize that my mom was very afraid of living in our home. So during that time, my sisters and I realized that we could go back to being daughters if we had the help of a care facility. But then there is the fear of finding the right place and the right care in the time of COVID. Unfortunately, my mother suffered many wounds and was never allowed to walk in the facility that she was residing in first, before Kensington. Kensington has been a second move. She was moved to Kensington about a month ago. Our family was fearful. We were afraid even to do the interview, to tell you the honest truth. But this is the important part. We put together a very comprehensive, specific questions for Kensington, and every staff member there knows how many questions we had for them. I'd like to give that list of questions to Robert so he can share it with other families. This was important because the day that we interviewed all the people from Kensington, nobody took offense to any question. They didn't get defensive about answering every question thoroughly. They explained their roles, their specific roles in the daily living of the residents, and how they communicated changes between staff members. Then they said, well, this is how we do it between our staff, but now this is how we do it with our families, so that you know what's going on. I get text messages, I get emails, I get phone calls all the time reporting to me the changes my mom's going through, or a good day or a great day. They just have a really very open transparency with families. The more transparent Kensington was with me, the more trust was gained. So this is the difference we found with Kensington. And we interviewed 4 quality places in the South Bay area. So Kensington was the last of the 4 interviews. And honestly, they made all the difference in the world. Our strategy for moving mom, this is a big one, guys. You need to pick the one that honors your loved one. Kensington offered us 3 different ways. This was a surprise to us. We thought she was just going to be taken by a gurney right into the facility. That's not what happened. They asked us if we wanted a 30-minute sit-down croissant coffee breakfast, or did we want to have a quick goodbye at the door, or did we want a fanfare, a big to-do of her coming into a facility and everybody waving hi? But we had to pick the one that fit her. And we opted for the one that was the 30-minute sit down with her 3 daughters, and for us to have a chance to say, we love you and we care about this. How we go about this, communicating it, that's the problem. We had to go about communicating with her to tell her that she's moving to a better place that would help her to get over her wounds, that would help her to get strong, and that she would walk again. The first place we had my mother in wouldn't allow her to walk. It wasn't that she couldn't walk, they wouldn't allow her to do it. And she was getting weaker by the day. So now she works just to get stronger every day. Although she still says that she's working hard to come home, she now expresses, I like it here. I like the people. I like how they take care of me. I like being around these guys. She kind of kids around with all of them. and then the staff members are getting to know her sense of humor and her wit. She has her dignity because there's caregivers are taking care of personal needs. She trusts those caregivers. She never has once complained about them. And she has loving visits with my sisters, myself, her son-in-laws, and all her grandchildren have been at the Kensington to visit in their courtyard visitation. So honestly, the strategy there is pick the strategy that fits and honors your loved one's personality.
Wow, that's going to make me cry. I'm so glad that you've had this experience, because none of us, I mean, our daughter, I'm a daughter, you're a daughter, and putting my father, your mother into a home, there's nothing worse. You just don't wish it on anyone. And I had the exact experience. We had a lunch with my brother and my mother and my dad, and said he was in a place to help him get better. And my dad used to run his own company, and they called him the mayor of Kensington because he greeted everyone at the door. At one point, someone that was there said, "Oh, one of the owners is here," and it was my dad. And they used to allow my dad to go into all of their meetings, and he'd take a pad of paper and a pen and just let him play the role. And it just pulls at my heartstrings that we both had that same experience. So thank you. Thank you so much. Another question. I know I need to move my loved one into an assisted living community that has memory care, but I am feeling so much guilt. I just can't make the decision and feel stuck. What do I do? David, could we start with you on that?
I think the first thing that you have to recognize is that, we have these emotional bonds to our parents. We have this lifelong sense of responsibility. We love them. And so we think that we are the best to provide services and care. And as people move further into, disease and progressive decline, it's no longer the case that loving, well-intended family members are the best people to support and provide the care. In good places, and truly the Kensington is one of the best I've ever seen. The staff is so well trained to provide things that a son and a daughter can't, or a grandchild can't. They know how to get someone up and out of bed and dressed in a way that doesn't push a schedule or an agenda, that supports their dignity, that gives them freedom. And so we feel guilty because we think in some way we're shirking our responsibility. But the best way to honor your parent is to provide them with what is best for them. It's heartbreaking because we just feel, and it's an irrational thought, it's because it's not true, but we feel like, oh my God, I should be able to do this. It's like when our child gets hurt, we think, oh my God, I should have been able to prevent it. He was at school, he was right. We have these feelings that get in the way, and we really need to set them aside and realize that. And one of the things I love that Debbie said is she and her sisters got to be daughters again. Parents really sometimes, they don't want their child to be handling intimate personal things sometimes. We want to really think about, we have to put on our grown-up suit and really think what is best, and acknowledge that all the love that we have is not always the best way to take good and appropriate care of our aging and declining parents.
You bring up such a good point that I think everyone should think about. And I think that was one of my biggest challenges, was role reversals. Suddenly, I wasn't a daughter anymore. I was a caregiver, and I had to, it was like an overnight thing, I felt like. So Debbie, I totally share your experience with that I got to be a daughter again and let Kensington take care of the bad things, and I got the good things again. Lorrie, do you have something to add for that?
Yes, and with loved ones, I always tell them to accept your limitations. You're not, and accept them, because you're not expected as a child or a spouse to take care of a loved one, especially with dementia. You have a married couple and it's like this to death do us part. And, oh, we promised each other we would never put them in a home, but you didn't take dementia into consideration, you know, back when you were younger, or back through your marriage. And it's very difficult for a spouse to put another spouse in a community, especially, you know, with memory care. Assisted living, a lot of them come in together as a couple, but when you have to leave a loved one in a memory care, and the spouse feels helpless, children feel helpless. But I often tell the caregiver, if you don't take care of yourself, if you don't take care of your health, you could go before your loved one. And it takes a village. It's not a one person cannot take care of somebody with dementia, especially if they have behaviors, especially if they wander. I knew wives that barricaded their front doors because their husband would go out wandering at night. And that it takes away from the quality of their life and them as a couple, because if you put them like the Kensington, we take such great care of them. Enjoy the visits, enjoy the quality time of life, and knowing that we're taking care of their loved one and giving them and granting them their dignity.
Thank you. And Lisa, can you add to that, please?
Moving my husband and making the decision to move him into assisted living and memory care was the hardest decision, gut-wrenching decision I've ever had to make. And I think with Alzheimer's and dementia, and being a spouse, especially, there's the component of the partnership, and when they're still in the early stages, they're here and then they're not, and they're here and they're not, and you find yourself so off balance. There's a component of failure because this job as a family caregiver is bigger than anybody. It does take a village. It does take a team. And once they're in, yeah, I mean, my husband was so angry when he moved, and he was still fairly independent, but I was working so much, and I'd already called 911 on myself and spent 2 nights in the hospital. I mean, it's horrendous, but I had to do it. And I think it's a leadership position when there's the role change of your parents, or someone has to step up and you have to pull yourself up by your bootstraps. And my husband was thanking me after a few months because it gave him a life, it gave him an environment. So, I mean, I could just keep talking and talking about this subject, as we all could, about that experience we've all gone through, but it's gut-wrenching. But when it comes time to moving, you now have a bigger team. It's not just you. And we need to lean on our trusted advisors. And I learned to do that. And so that's, I just wanted to say that it's really tough.
It is so tough.
Susan,
Gil,
can I jump in?
Go ahead, David.
You know, one of the things that I forgot to talk about is that throughout all the stages of this process, the caregivers should be talking to someone. So, you know, at my company, Wellqor, I have people who are in memory care, and that individual, their dementia is so far advanced that, you know, no therapy in the world is going to really help them. But I meet weekly with wives who have had to deal with this guilt. I work with families, and Medicare pays for these services for families to deal with the emotional stress, the trauma, the upset, the adjustment of having to go through this with a loved one. So, you know, help is very, very available, psychological and emotional support, for you, the loved one and the family, the caregivers, because you know what I say, put your mask on first so you can help others. Because caregiver self-care is so important, and it really is available, and people may not know that.
That's a really good point. When Debbie and I were talking on the phone, she said, any silver lining, having to do with her mother and my father, she said, but we're getting to meet people like each other, and we get to talk about and share experiences, which is so therapeutic. So thank you. This is a more specific question. What type of physical and mental activities are planned for residents to guard against loneliness and depression? How often are the activities planned, and is there adapted programs in the crisis of COVID? And Lorrie, I think it's perfect to start with you on that.
The Kensington provides and offers a lot of different activities throughout the day. Assisted living residents and memory care residents, there's a daily agenda that they can pick up and see what type of activities are provided. Assisted living is able now to go outdoors to have exercise classes. We have an instructor coming in, socially distanced. The residents are socially distanced as well. They wear masks, they wear the proper protocol, and it's good to get them back outside, get some fresh air and do some exercises. We also have art classes, flower arranging, trivia. Memory care has viral exercise classes and also entertainment. We're allowing some entertainment to come back in. So we have happy hour in both memory care and assisted living. And the musician is socially distanced outside, and the residents get to sit around and enjoy the music. We have karaoke, and our care managers will get the residents up and dancing. And it's a really good, positive environment. If you didn't see the masks, you wouldn't know we had COVID, because there are activities, there's movie night every night. And we have what's called pocket programming. So let's say you have a group of ladies and they want to do flower arranging, but you have a group of men that really don't want to partake in flower arranging. So we'll have different type of trivia for them, some sports trivia. If there's a game on TV, we had the Dodgers World Series, we had it decorated. So we look at the current events, what's going on, and we kind of plan activities around that as well.
That sounds wonderful. Thank you so much. Another question is for all of our panelists today, and that is, are there important factors to consider differently during COVID, moving our loved ones into a community? And if a community had an outbreak, does that mean it shouldn't be considered? Are there upsides or opportunities for moving now during COVID? I mean, we certainly know it's not going away. So if you could share some light on that. And David, can we start with you?
Sure. Sometimes when people are moving into assisted living rather than memory care, there are lots of different reasons, once again, for that. Sometimes if someone's having memory problems, but they're still mobile and out in the community, they may actually not be so safe because they may forget to wear the mask. They may forget to sanitize when they walk into the grocery store, right? They may forget. I mean, it's hard not to touch your face. Let me tell you, I'm sitting on Zoom all day now, and I know how, my gosh, right? And so there are safety challenges that we're all facing, that even an elder who's not so declined yet, but their short-term memory, their immediate attention struggles put them actually at risk because of COVID. And so a community that has created a safe space, that has figured out how to have golfing and movie night and bingo, and I mean, those are the places that you want to send your loved one to. Just because a community had an outbreak should not take that in and of itself shouldn't take them off the list. It's how did they respond to it? What has their response been? Was it early? Was it late? And how and have they had an outbreak since? Because we know in life, we all make mistakes. The test of a man's character is how he responds to them. I know that when COVID first happened and there was an outbreak in the community, just like the rest of the world, everyone was on lockdown, right? Residents were in their room all day long. They were taking their meals in their room all day long. And after they figured it out, in the better communities, that's not the case anymore. I was working with an individual today, and he's still in his community, they're still not eating in the dining room. He's in his room the entire time. And then that increases, depression, loneliness, ruminations. When we're alone with our own thoughts, even the best of us, it's going to start wearing down on us. So it really is how a community has responded to the crisis and how they figured out how to do their best job and in the business that they are in to provide dynamic living opportunities for their residents.
Yeah, very good point. Debbie, do you have something to add on that? You just went through this with your mom.
Yeah, I really do. This is a real important factor for our family. The most important factors for us for choosing a facility were the good medical staffing, which Kensington was far and above because of having 3 RNs on their staff, having a good medical staff and caregiver ratio to resident. They have 24 LVNs and they have CNAs as the other caregivers. The communication between the staff and the families had to be one of our highest priorities. And then a strong activities department, like Lorrie was saying. I have pictures of my mom 1 week after a memory care facility said that she can never walk. I have a video of her dancing. And she was dancing with her caregiver behind her and holding a gentleman's hand. That is a priceless video because Kensington believed in her and believed that she could walk again. She does walk. These were some of the bigger things that were the factors for us to build a trust during the difficult transition to during COVID. But before we interviewed Kensington, we knew that the facility had had a COVID outbreak early in the spring, at the beginning of the shutdown. During that interview, this is how they explained it to us. They explained how their protocols changed, how they addressed both the physical safety of the residents, but here's the thing that makes them set apart from every other place. They addressed the residents' need to connect with families. In our experience, Kensington has said everything they have told us has happened. They encourage us to have visits. We have courtyard visits with 2 family members and my mom at a time, and they're 45-minute visits. These visits are necessary for the residents because it wards off depression or confusion. Why am I here? Why am I locked away? Well, my mom just thinks that we're just coming every day to hang out with her. Although it's probably tricky for Kensington, here's what sets them apart. They put the human connection just as important as the safety considerations to make a balanced program. And the upside of all this is the residents aren't alone. They do physical activities, exercise classes together, and they talk about those things with their loved ones at their meetings. Well, not really meetings or visitations. They're grouped together based on how well they can communicate. So the ones that really are looking for friendships, Kensington is doing that. The caregivers group those people together. In the mornings, they are allowed to go for walks with the caregivers. The things that are priceless about this is they send me videos and pictures of it so that I know my mother's having a great time, but I also have things to talk about with her and let me be a part of her life and that she has things to add to our lives by telling us about all the things that she's doing with her friends at Kensington.
So
So,
important.
yeah,
important
so thank
for
you so
just
much.
overall health. I mean, they take such good care of all the residents and their families. I mean, it's been just fantastic for my mother and for me. They take care of us equally. Well, we are just coming to a close, and I cannot thank Lisa, Lorrie, Debbie, and David enough. I think your insight into assisting people that are going through this very difficult process has been invaluable. And everyone that joined us today, we will send you a copy of the webinar. Please share it with friends and family. We hope that this will help others in this situation. And we will provide you with links to each of us. Reach out, ask us questions. I know Debbie would be open to that. I certainly am. And Lorrie, David, and Lisa as well. So thank you so much, and please be safe, and pat yourself on the back if you're a caregiver. Thank you.